Hello everyone, my name is Dr. Brown and today we're going to talk about my worst enemy, multiple sclerosis. What is multiple sclerosis? It's an autoimmune disease that attacks your body, and this attack comes from your own immune system. The melanin of your brain slowly diminishes because of this attack, which covers the nerve fibers in your brain. And once these nerve fibers are exposed, that creates damage to your nervous system. There are many people who are affected by multiple sclerosis. I always thought that multiple sclerosis was only diagnosed in people with Eastern European descent, but come to find out that multiple sclerosis is diagnosed in women more than it is in men. And with this, now I have to deal with having multiple sclerosis for the rest of my life. There are symptoms of multiple sclerosis that not everyone experiences, but some people do and some people don't. Fatigue and weakness is one, visual impairment, numbness, paralysis, or poor coordination. Some of the symptoms that I experience are the fatigue and the weakness, the numbness, cognitive dysfunction, and pain. Multiple sclerosis progresses from time to time. Sometimes you don't, and sometimes you do. And with multiple sclerosis, there are ways that they determine whether or not you have it. They do it through spinal test, that's lumbar punctures, where they extract fluid from your spinal cord. They also do a sensory evoked potentials, which is called EMG also, where they do electric shock through your body, through your arms and your legs. And then there's the MRI, where you go through a tunnel and they take images of your back, your spine, your neck, and your head. And the conclusion is finding out where the lesions are. The types of multiple sclerosis are relapsing remitting MS, which is most common with people who have MS, secondary progressive MS, primary progressive MS, and progressive relapsing MS. And with these types of MS, there are also different symptoms that the person or the individual goes through. There's always potential for new symptoms to come when you have either one of these types of multiple sclerosis. With multiple sclerosis, MS, there is no cure for this, but there are treatments that you can take. You can do infusions, oral medications, injections, physical therapy, or muscle relaxations. I take oral medications. I take one to control the MS from having more symptoms occur. And with these medications, there are side effects. Side effects range from blindness, inability to control your blood pressure, or low blood rate. Other medications include that helps the depression, which I suffered from. And there are also medication for the muscle relaxation, which I also take too. So there are 3 medications that I take daily to help manage my daily or my routine of dealing with MS. So every day I have to worry about if I'm able to go to work, or if I'll be able to stand up or to care for the children that I teach and that are under my care every day. And this is a process that I have to deal with. And with that, I also wonder, should you tell your employee what are they to do? Will they have you, quit your job, tell you that you can't work there anymore? And when that happens, the next procedure is unemployment or disability. And with disability, there's always a guarantee that you will be approved. And then you go through an appeal process, and then that may not be approved either. So where are you now? You're stuck with wondering what your life is going to be like, dealing with the symptoms that you have, These are the things that people with MS struggle with every day. We wonder, what should we do? Should we just give up or should we continue? The medications that we have are not always efficient, as I told you before. Every day, I have to struggle with this. And sometimes I have to be strong and not let anyone see my fear of whether or not I'll be able to walk when I get out of my bed, or if I'll be able to stand or walk up a flight of steps. Now today, every day, if I'm with my daughter, I have to walk up the steps with her behind me. And it's a challenge. And I don't know where to go from here. I thank you all for participating in this speech, or coming to the speech, or joining me with this. And sorry, but it's kind of hard talking about it. And if my words are jumbled, I do apologize. But I thank you again. And thanks for coming. Bye.